authorities and United Nations agencies began a large-scale campaign of vaccinations against polio in the Gaza Strip with hopes to prevent an outbreak in the territory that has been ravaged by the Israel-Hamas war. The campaign began with a small number of vaccinations on Saturday and aims to reach about 640,000 children. Meanwhile, the World Health Organization has said Israel agreed to limited pauses in the fighting to facilitate the campaign. However, Israeli military striked in central Gaza early on Sunday. The vaccination program is set to continue through September 9 and last 8 hours a day. Now to discuss this, we're joined by Mohamed Mughaiseb, health personnel. He joins us live from Gaza, Palestine. Thank you so much, Mohamed, for joining us. All right, Mohamed, if you can hear me, what is the current situation or the status of the polio vaccination campaign in Gaza as we speak? How many children have been vaccinated recently?
That it went well, I think, in the couple of 2 days now. This is the third day of the campaign. More than 150,000 children under 10 years old have been vaccinated. I think they will finish the campaign in the middle area. They will start more southern of Gaza city. It means Khan Yunis and Rafah area. I hope that things will continue calm during the vaccination time. Still, there is airstrikes, there is bombing. But or near the post of vaccination, it's quiet.
Right. Speaking of the vaccination, what specific challenges are you encountering when it comes to implementing this polio vaccination program amid the ongoing conflict? Because there are two battles now, the health challenge and, of course, the war that is going on.
It was a big challenge for all the actors, mainly WHO, the health authorities in Gaza to launch this campaign. It took a few weeks to have the permission from the Israeli side to get in the vaccines. Logistically, it's a big as well challenge. All the infrastructure has been destroyed. Majority of the clinics and hospitals has been partially destroyed. So to find a medical post ready to vaccinate, it was a huge challenge. Finally, the campaign started. I think people are as well really are encouraged to get their kids vaccinated. And this shows that the population really wants to have peaceful life. And it's a very difficult situation, as you mentioned, since the last 320 days of war.
Right. Talking about accessibility, we understand that some of the areas are particularly difficult to reach because of this war. But how have the access to the different communities been affected by the conflict? And what are these areas that are hard to reach this period?
All Gaza Strip are very difficult to access now. Accessibility is one of the huge concerns for all medical actors. There is no proper transportation. There is no infrastructure roads. The hospitals and the centers are partially destroyed, not functioning. Gaza cut is in two parts or in 3 parts sometimes. So the population is really, the accessibility is very difficult. People are using traditional transportation methods to reach other areas or to walk. The situation is not very easy, but the population trying their best as well to be treated and to seek medical care.
All right. Thank you so much for joining us, Mohamed Mughaiseb, health personnel, and giving us a little bit insight into what's going on currently. Thank you once again for your thoughts.